Hi everyone, and welcome back. When you apply to medical school and dental schools, in the interviews you're asked to demonstrate your ability to manage ethical situations. And when it comes to treating children and young people, two legal ethical concepts come to mind. And it's essential, it's very important that you can navigate those and be able to incorporate them into your answers. And that is Gillick Competence and the Fraser guidelines. These concepts are about autonomy, so they relate very closely to that ethical pillar. The right of a patient to make their own decisions and how that right evolves as the child grows up. This knowledge is absolutely crucial in the interviews. It's very important you understand this. So let's start with Gillick Competence. In the UK, the age of the majority, it's 18. And 16 and 17-year-olds are assumed to be capable of consenting to treatment. But what about the patients who are under 16? Do they always need their parents' permission? There was a landmark case of Gillick versus West Norfolk and Wisbeck in the 1980s. And that established that a child under 16 can potentially consent to medical treatment. And that's without parental knowledge or permission. But it depends on whether they are Gillick competent. So what does competence mean? Gillick competence says that it doesn't depend on a magic number. It depends on the child's maturity and understanding. You as the clinician need to decide, does the child have sufficient understanding, i.e. can the child understand the nature and the purpose of the proposed treatment or procedure? Does the child understand the implications and risks? Can they understand potential risks, side effects, consequences of having the treatment, and also the consequences of refusing it? Can they display the ability to weigh up decision, i.e. can they use all the information to weigh up the options and make a reasoned choice? Crucially, Gillick competence is decision specific. A 14-year-old might be competent to consent to a flu vaccine, but they may not be competent to consent to a complex, life-altering procedure. Every decision requires a fresh assessment. Now let's talk about the Fraser guidelines. This is where many candidates get confused, so you need to pay close attention to this. The Fraser guidelines were set out by Lord Fraser during the same landmark legal case. They are not a general test for consent. They are a set of criteria to apply specifically to a clinician giving advice or treatment relating to contraception and sexual health to a younger person under the age of 16. The Fraser guidelines set out 5 key criteria. A clinician can provide confidential contraceptive or sexual health advice without parental consent only if they are satisfied of 5 things. I call it the 5 musts. Number 1, the young person must understand the doctor's advice. Number 2, the young person must not be persuaded to inform their parents or allow the doctor to inform them. The young person, that's number 3, they are likely, they're likely to begin or continue being sexually active with or without the contraceptive treatment. So that's number 3. What's number 4? Number 4, the young person, their physical or mental health is likely to suffer unless they receive the advice or treatment. Last but not least, the young person's best interest is to receive the treatment without parental consent. So these are the 5 things to think about. So there is a clear distinction between Gillick, i.e. general consent, versus Fraser, which is a specific consent for contraception or sexual health advice. So in simple terms, Fraser it's got a specific application, and Gillick a broader application. Okay? So why is this important for you as a future clinician? Well, look, you need to demonstrate an understanding of this and your commitment to patient-centered care and your grasp of UK medical law. In an interview scenario, you might be asked, a 15-year-old comes to you requesting the contraceptive pill, but doesn't want their parents to know. How do you proceed, right? Your answer must include some form of assessment of Gillick competence. Do they understand the pill, the side effects, risk of STIs, any alternatives? You need to apply the Fraser guidelines, i.e., do they meet the 5 musts? Have you encouraged them to involve their parents? Maintaining confidentiality. Are they competent? Does their consent override the patient's right? Maintain confidentiality, i.e., if they are competent and their consent overrides the parents' right to know. Safeguarding, priority of safeguarding, i.e., always remember the safety net. If a young person discloses anything that puts them at risk of significant harm, i.e., sexual activity under the age of 13, grooming, raping, etc., confidentiality must be broken and you follow safeguarding procedures. So Gillick competence is about empowering young people to take control of their health. And the Fraser guidelines provides a safe, ethical framework for the most sensitive areas of care. You need to master these concepts and prove that you're ready. You're ready for the ethical challenges of medicine. I hope you found this video useful. Press the like button if you can. Have a look at our website. There's loads of information there that'll help you in your forthcoming interviews. Good luck.